Hey guys, Oscar here with Gastroenterology Simplified. Today we're going to dive into our first topic. We're going to talk about esophagitis. What is esophagitis? Esophagitis is the inflammation of the esophagus, also known as the food pipe. And the esophagitis or the symptoms for esophagitis could present as dysphagia, which is painful swallowing, dysphagia, which is difficulty swallowing, atypical chest pains, chest tightness, and acid reflux. When you go to your doctor and you are experiencing atypical chest pains, trouble swallowing, painful swallowing, chest burning, you could be experiencing esophagitis. What are some of the causes for esophagitis? We have infection, we have pill-induced esophagitis, and we could also have radiation esophagitis. Let's talk about infectious esophagitis. Infectious esophagitis is caused by an infection, such as Candida, which is a yeast infection. It could also be caused by herpes infection. So if you are experiencing oral herpes, you could also have esophagitis due to herpes, and also CMV, which is a viral infection. Now, infectious esophagitis is usually present in individuals that are immunocompromised, so their defense are very low. Now, the other type of esophagitis is also known as pill-induced esophagitis. This is very common in the elderly when they are, for example, in a nursing home. They take the medications, they're laying down, the pill gets kind of stuck in their esophagus, or the pill stays in the esophagus for a longer period of time, and then it causes pill-induced esophagitis. The other type of esophagitis is called radiation-induced esophagitis. Just how the word says it. The esophagitis is caused by radiation. Someone that has some type of cancer and is getting radiation for their cancer treatment. That usually causes radiation esophagitis. The symptoms for these three types of esophagitis are pretty much the same. Trouble swallowing, painful swallowing, atypical chest pains, chest pressure or substernal pressure. You also have esophageal burning or chest burning, even epigastric burning. What could your doctor do to find the true diagnosis of what could be going on in your esophagus? So the most common initial way to diagnose your symptoms is by doing an esophagram. What is an esophagram? Esophagram is pretty much a picture of your esophagus. So you have to present to a radiological setting in either at the hospital or standalone, and they do an esophagram. The esophagram, once again, they make you drink a liquid, and then once you drink the liquid, they take a picture of your esophagus, and that will let your doctor know what could be going on in your esophagus. Also, there is a test that is called esophagram with a tablet. This test is pretty much the same as the esophagram, but they also give you a tablet, which it dissolves on the way down to your stomach, and they measure how long or how difficult it was for the pill to go down your esophagus all the way to the stomach. Okay? Now, if a definite diagnosis is needed, then you will need an upper endoscopy or an EGD. An EGD is a scope that is introduced per mouth, has a camera at the end, and that will take a look at your esophagus, your stomach, and also the beginning of your small intestine, which is called the duodenum. Now, when the endoscopist or your gastroenterologist performs this procedure, you will usually be at sleep with light sedation. The scope is introduced per mouth. It takes a look at your esophagus, your stomach, your duodenum. Then your endoscopist will probably choose to take random biopsies, and then the biopsies are taken to the pathology department, and they will study on their slides to see what's going on with your mucosa, with your gastric mucosa, and that will give you a definite diagnosis. Okay, depending on the diagnosis that you receive, let's say you have infectious esophagitis, or you have pill-induced esophagitis, or you have reflux-induced esophagitis, the treatment may vary. So if you have infectious esophagitis, you may need either an antifungal medication, an antiviral medication, or you may need even some antibiotics. If you have pill-induced esophagitis, then you're going to be placed on an acid-reducing medication, and you're going to have to be sitting up at 90-degree angle every time you take your medications with plenty of water, so the medication goes down your throat or your esophagus easily. If you have reflux-induced esophagitis, then the management will be with an acid-reducing medication. Also very important, and this is the key, a GERD-friendly diet, meaning a type of diet that avoids red sauces, spicy foods, caffeinated drinks, carbonated drinks, and so on. Okay? Now, going back to the infectious esophagitis, in addition to the antifungal medication, antiviral medication, or even an antibiotic, you will likely also need an acid-reducing medication. In conclusion, esophagitis is inflammation of the esophagus. You could be experiencing esophagitis due to an infection, due to reflux, due to pill-induced esophagitis, and even radiation esophagitis. The initial diagnosis is usually done by an esophagram. Your doctor may choose to do a standalone esophagram or an esophagram with a tablet, which will let the doctor know if there's a stricture or not, and it gives them more information on what's going on in your esophagus. The treatment is depending on the type of esophagitis you have, and most importantly, you will need to take the medication, complete your medication, and also follow a GERD-friendly diet. You can go ahead and Google GERD-friendly diet, and that will give you more information. Guys, I hope this video was helpful. I hope this video was informative. If you like this video, click like, make sure you subscribe to the channel so I can bring you guys more informational videos. Thank you, and I'll see you in the next one.